So we've made a decision to make a change in our program. So the panel discussion that we would have had now, we're going to blend in with the policymaker panel. Before we stop, we have two things. One is that we need to do our question, which Carol is bringing up. But while she's doing that, there are four people that I'd like to actually ask to come up front, if you could. And Dr. Ricardo Massetti, Dr. Alex Enyu, Dr. Bob Carlson, and Dr. Shala Massoud. If you could please just come up to the front here. We need to have a moment. And it may be that Dr. Enyu had to boot out to the airport if he's not. Oh, nope, there he is. We began the Breast Health Global Initiative together in 2002, and these four people have been with us for every global summit from that very beginning point. And I just wanted to take a moment to acknowledge them, and specifically to provide the Breast Health Global Initiative Founding Collaborator Award. Hippocrates said, a wise man should consider that health is the greatest human blessing. This is particularly true when one has very few resources. My friend Ricardo Massetti, I think, really optimizes this selfless contribution, as you've seen in the work that he's been doing through the Hope Exchange, much through not just his volunteering his time and resources, but he's an example of someone who in country is reaching out beyond what's possible. We also need to recognize that the integrating resource-based treatment strategies, the thinking process. Another point that Hippocrates made was there are two things in science and opinion. The former begets knowledge, the latter ignorance. And Dr. Enyu and Dr. Carlson have been the intellectual drivers of the processes. It is these gentlemen that thought of the resource stratification and the checklist development strategies that I think are the basis of what we're talking about today. Finally, Hippocrates also said, sometimes give your services for nothing. And in the ultimate gift, I think that Dr. Massoud has been just fabulous. She was the editor. She took a real chance in allowing us to publish our first and second guidelines as a supplement in this peer-reviewed setting, and she believed in us. At a personal level, Dr. Massoud has been a mentor to me from the early points in my career, and the one part that's really amazing is that somehow I get older and she does not. But she has been such a fabulous leader for so many young faculty trying to get their feet on the ground in terms of how to progress academically. And so for these four people, if we could just have a round of applause for the BHGI Founding Collaborator Award. Thank you. The question that we have, do you believe that breast cancer downstaging is most impacted globally by increased access to mammography, public education about early detection, use of clinical breast exam, or government investment in screening? If you could answer that question, please. Three, two, one. There we go. Very interesting. Now, for lunch, same rooms as downstairs. The Breast Health Global Initiative Steering Committee that met on Tuesday, we have a special room to regroup for this lunch. That will be in the Colorado room, also on the second floor. So if the steering committee members could go there. The working group co-chairs are also invited to that, if you could go to the Colorado room. We will reconvene here at 1:45